What if I told you that your skin is actually a high-definition monitor, displaying exactly what is happening inside your heart, your lungs, and your digestive tract right now? Most of us look in the mirror and only see aesthetics. We see a new wrinkle, a pesky breakout, or maybe a bit of dryness from the winter air. But to a trained medical professional, your skin is a storyteller that never lies. It serves as an early warning system for internal crises that haven't even caused pain yet. There are specific marks, colors, and textures that can appear on your face, your arms, or even your shins that top doctors will never ignore. These are the red flags that suggest a deep-seated issue is brewing beneath the surface. Today, we are stripping away the surface-level beauty talk and getting into the serious science. We are identifying the 8 skin signs of serious disease that you might be brushing off as a simple rash or a birthmark, but could actually be your body's way of sounding a desperate alarm. If you have been noticing a strange change in your skin's appearance lately, stop what you are doing and listen. This information could be the bridge between a mystery illness and a life-saving discovery. Let's jump straight into the first sign, and it is one that many people mistake for just being a bit dirty or having a tan that won't go away. I am talking about dark, velvety patches of skin that usually appear in the folds of the body. In the medical world, this is called acanthosis nigricans. At first glance, it might just look like a smudge of charcoal or a darker pigmentation, but if you touch it, it feels like fine velvet. This isn't a skin infection or a hygiene issue. This is a massive billboard for insulin resistance. Your body is screaming at you that your blood sugar levels are chronically high, and your cells are no longer responding to insulin effectively. This is often the very first visible sign of type 2 diabetes, or a condition called polycystic ovary syndrome. In much rarer cases, if these velvety patches appear very suddenly and spread aggressively to the palms of the hands or the soles of the feet, it can even be a signal of a hidden issue in the stomach or liver. It is time to put down the exfoliating scrub and pick up a blood sugar monitor. Your metabolic health is waving a white flag. Moving on to the second sign, have you ever noticed small, yellowish, fatty bumps or plaques appearing on or around your eyelids? These are known as xanthelasma. They might look like small grains of sand, or little raised yellowish patches of skin. Many people think they are just harmless skin tags or perhaps a reaction to a new eye cream. But doctors see them and immediately think of one thing: cholesterol. These deposits are actually localized collections of lipids, or fats, that have leaked out of your bloodstream and settled in the thin skin around your eyes. Seeing these is a clear indicator that your fat metabolism is out of balance. It is often a sign of severely high LDL cholesterol, which is the type that clogs your arteries. While the bumps themselves won't hurt you, they are a visual representation of what might be happening inside your heart and your carotid arteries. If your eyelids are starting to look like they are storing fat, your cardiovascular system might be under a level of stress that you can't feel yet. The third sign is something that people often mistake for a simple bruise or perhaps a burst blood vessel from a minor injury. It is called purpura, and it looks like purple or reddish spots that do not turn white when you press on them. If you have a normal bruise and you press it, it usually pales slightly. But purpura stays deep purple because it represents blood that has actually leaked out of the tiny capillaries and into the skin tissue. They aren't thinking about a bump against a coffee table. They are thinking about vasculitis, which is an inflammation of the blood vessels, or potentially a serious blood clotting disorder. It could even be a sign that your platelet count has dropped to a dangerous level. This is your body's internal plumbing system leaking, and it is a sign that the structural integrity of your circulatory system is being compromised by an underlying inflammatory process. Never ignore a purple spot that doesn't behave like a normal bruise. Now, let's talk about the fourth sign, which is found on the shins. This one is quite striking and hard to miss once it develops. It is called necrobiosis lipoidica. It starts as a small, dull, red raised area, but over time it evolves into a larger, shiny, yellowish-brown patch with a distinct violet border. The skin in this area often becomes very thin and translucent, to the point where you can actually see the tiny blood vessels underneath. For a long time, this was thought to be exclusively related to diabetes, but it is actually a sign of significant collagen breakdown and small vessel disease. It can be quite itchy or painful, and because the skin is so thin, it can easily turn into an open sore that refuses to heal. When a doctor sees this on a patient's shin, They know they are looking at a deep vascular and inflammatory issue. It is a sign that the body's ability to repair its own connective tissue is being severely hampered by a systemic disease. The fifth sign is perhaps one of the most famous in medical history, and yet it is still missed by thousands of people every year. It is the classic butterfly tokens, rash. This is a red or purplish rash that spreads across the bridge of the nose and onto both cheeks, creating a shape that looks exactly like a butterfly with its wings spread. Unlike a common sunburn or rosacea, this rash typically spares the nasolabial folds, which are the creases that run from the sides of your nose to the corners of your mouth. This specific pattern is a hallmark sign of systemic lupus erythematosus, a serious autoimmune disease where the body's immune system starts attacking its own healthy tissues. This rash often flares up after you have been in the sun, suggesting that your skin's DNA is becoming hypersensitive to light due to internal inflammation. If you wake up with a butterfly across your face that doesn't go away with moisturizer, your immune system might be in a state of civil war. The sixth sign is something that often gets dismissed as a sign of getting older or hard tokens, work. But it is actually a major clue about your internal organs. I am talking about clubbing of the fingernails and the skin around them. While this technically involves the nail, it is the soft tissue and skin at the base of the nail that changes first. The skin becomes shiny and soft, and the angle between the nail and the nail bed disappears. Eventually, the tips of the fingers look bulbous, almost like the ends of drumsticks. This is a classic sign of chronic low oxygen in the blood. When a doctor sees clubbed fingers, they aren't looking at your hands. They are looking at your lungs and your heart. This can be a sign of chronic obstructive pulmonary disease, lung congestion, or even underlying heart defects that have been present since birth. It is a sign that your peripheral tissues are starving for oxygen because your central systems are failing to deliver it. For the seventh sign, we have to look at something that appears like a sudden explosion of barnacles or moles on the skin. In medical terms, these are called seborrheic keratoses. They are those brown, crusty, stuck-on looking growths that many people get as they age. This is when dozens or even hundreds of these growths appear very suddenly over a period of just a few weeks or months, often accompanied by intense itching. When this happens, it is a massive red flag. This sudden eruptive growth of skin lesions is often the body's reaction to an internal malignancy, particularly in the stomach, colon, or liver. The cancer cells release growth factors into the bloodstream that cause these skin cells to proliferate wildly. The eighth sign is one that is often very itchy and very localized. It is called dermatitis herpetiformis. Despite the name, it has nothing to do with the herpes virus. Instead, it looks like clusters of tiny, incredibly itchy blisters and red bumps that usually show up on the elbows, knees, or the back of the scalp. The itch is so intense that people often scratch them until they bleed. This is actually the skin token's MAM version of celiac disease. It is a sign that your body is having a severe autoimmune reaction to gluten. When you ingest gluten, your body produces antibodies that travel through the bloodstream and deposit in the skin, causing this explosive, blistering reaction. Many people with this skin sign don't even have the typical stomach aches or bloating associated with celiac, so they never suspect their diet is the cause. If your elbows are constantly covered in itchy blisters, your gut might be in a state of total rebellion against the bread and pasta you are eating. Now that we have covered these 8 signs, take a deep breath and think about the last time you really looked at your skin, not just to check for a blemish, but to really observe the colors and the textures. We live in a world where we have been taught that skin issues are purely cosmetic. We spend billions on creams and lasers to make the outside look perfect. But the most expensive cream in the world won't fix a butterfly rash caused by lupus, and it won't melt away the cholesterol deposits on your eyelids. These signs are gifts of communication. They are silent messages from your internal organs, giving you a chance to catch a problem while it is still manageable. Why is the skin such a good communicator? It's because the skin is highly vascularized and highly sensitive to hormonal and chemical changes in the blood. Your skin cells are constantly being replaced, which means they are highly reactive to what's happening in your environment and your internal chemistry. When your liver is struggling, the bile salts build up and make you itch. When your kidneys are tired, the waste products change your skin tone. When your heart is weak, your extremities turn blue or swell. The skin is the canvas upon which the story of your internal health is painted every single day. One of the most dangerous things we can do is wait and see. We see a strange patch on our leg and we think, oh, it's probably just a dry spot. Or we see our neck getting darker and think it's just the sun. But medical progress is built on early detection. The difference between catching insulin resistance when it first shows up as a velvety patch on your neck versus catching it after it has damaged your nerves and eyesight is monumental. There is always a catalyst, and often that catalyst is found deep inside. Let's look more closely at the relationship between the skin and the heart. The skin on your legs in particular is a great indicator of how well your pump is working. If you notice that the skin on your lower legs is becoming shiny, hairless, and very thin, it could be a sign of peripheral artery disease. Your skin isn't getting enough blood flow to maintain its hair follicles or its normal thickness. If you notice that your legs take on a brownish, stained appearance around the ankles, that is called stasis dermatitis. It means the valves in your veins are failing, and blood is pooling in your lower legs, causing iron from your red blood cells to actually stain the skin from the inside out. This isn't a skin problem. It's a gravity and circulation problem. And what about the skin's connection to the mind? We often see nervous tokens, NAMUS 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 tokens. They are essentially cousins. When your brain is under high stress, it releases cortisol and other hormones that directly affect the inflammatory markers in your skin. This is why conditions like psoriasis or eczema often flare up during a difficult time in your life. Your skin is literally wearing your stress for the world to see. It is a physical manifestation of a psychological state. The connection between the gut and the skin is also becoming more apparent every day. The gut-skin tokens, NAMUN 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 tokens. Or if you have a leaky tokens, DIAD inflammatory compounds can escape into the bloodstream and trigger skin conditions like acne, rosacea, or the dermatitis herpetiformis we discussed. This is why many people find that their skin clears up not when they change their soap, but when they change their diet. Your skin is often the final destination for the inflammation that starts in your digestive tract. I want you to become an advocate for your own health. When you go to the doctor, don't be afraid to point out a new spot or a change in texture. Don't let someone tell you it's just a bit of eczema if it feels like something more. You know your body better than anyone else. You know what is normal for you and what isn't. Doctors have the training, but you have the data. You are the one observing the changes in real time. Think about the butterfly rash again. It's so distinctive, yet so many people spend months trying to treat it with acne medication before they realize it's something internal. Think about the velvety patches of acanthosis nigricans. How many people are at the gym right now trying to lose weight, not realizing that those dark patches are telling them exactly why they are struggling to lose weight in the first place? Their insulin is too high, and their skin is trying to warn them. The beauty of the human body is its interconnectedness. Nothing happens in a vacuum. Your heart, your lungs, your liver, they are constantly talking to each other. When you learn the language of the skin, you are essentially learning how to read the internal memo of your own biology. You are gaining a superpower that allows you to see the invisible. It's also important to remember that not every spot is a sign of a serious tokens NAMUN disease. The goal isn't to live in fear of every freckle. The goal is to be an informed observer. Most skin changes are benign. However, the signs we've talked about today are the ones that carry a heavier weight. They are the ones that have been linked over and over again in medical literature to specific internal conditions. They are the great tokens, namitators that can lead to a diagnosis that might have otherwise been missed for years. In a world full of digital screens and distractions, it is easy to become disconnected from our physical selves. We spend so much time looking at the skin of our phones and computers that we forget to look at our own. I encourage you to make it a habit once a month to do a skin tokens check. Not just for skin cancer, pay attention to how things feel, not just how they look. Is it itchy? Is it velvety? Is it thin? If you see something that matches one of the 8 signs we discussed, don't panic. Panic doesn't solve problems, but action does. Reach out to a dermatologist or a general practitioner. Tell them exactly what you've observed. Use the names we've talked about today, like acanthosis nigricans or xanthelasma. Being able to describe these signs accurately helps your doctor cut through the noise and get to the heart of the matter faster. We often think of health as something that happens to us, But it is actually a conversation we are always having with our bodies. These skin signs are your body asking you to listen. It is providing you with a visual map of where it needs help. When you respond to those signs by seeking medical advice or changing your lifestyle, you are participating in that conversation. You are telling your body that you hear it, and you are on its side. Imagine the relief of finding out that your chronic fatigue and your itchy skin were both linked to a gluten intolerance that you can easily manage. Imagine the power of catching a high cholesterol issue because of a tiny yellow bump on your eyelid, before it ever turned into a heart attack. This is the power of observation. This is the power of being dialed into the language of your skin. Your skin is a masterpiece of biological engineering. It protects you. It regulates your temperature. It gives you the sense of touch, and it acts as your most honest medical reporter. Treat it with the respect it deserves. Feed it from the inside out with good nutrition and hydration. Protect it from the outside from excessive sun and harsh chemicals. But most importantly, listen to what it has to say. The next time you look in the mirror, look past the surface. Look for the stories your body is trying to tell. If you see a butterfly, a velvet patch, or a spider-like vein, don't look away. Those marks are not flaws. They are information. They are the clues that can lead you to a longer, healthier, more vibrant life. We've covered a lot today, from the eyes to the toes. We've talked about how sugar affects the neck, how fat affects the eyelids, how inflammation affects the cheeks, and how oxygen affects the fingers. This is the interconnected web of human health. It is complex, it is beautiful, and it is entirely focused on keeping you alive and well. As we conclude this deep dive into the signs doctors never ignore, I want you to feel empowered. You are now armed with knowledge that most people simply don't have. You know what to look for, and you know why it matters. You are no longer just a passive observer of your skin. You are an active participant in your own healthcare. Take this knowledge and use it. Share it with a friend who might be struggling with a mystery symptom. Keep it in the back of your mind as you go about your day. And always remember, your skin is much more than just a covering. It is your body's most visible and most vocal advocate. When it screams, it's for a reason. When it whispers, it's for a reason. All you have to do is be willing to look and willing to listen. Your health is written all over your face, your hands, and your heart. It's time we all learned how to read it. Thank you for your attention today and for taking this important step in understanding the incredible machine that is your body. Keep your eyes open and stay tuned into the signals that keep you strong.